Hi everybody. Today we will be learning about pulmonary edema. What is pulmonary edema? It's a condition where fluid accumulates in lung alveoli. Normally the alveoli is clear and air moves in and out of the alveoli when we breathe and gas exchange takes place. But in pulmonary edema, fluid accumulates in lung alveoli causing shortness of breath and hypoxemia. Now, what causes pulmonary edema? The causes. It can be categorized into two, cardiogenic and non-cardiogenic. What is cardiogenic pulmonary edema? Cardiogenic pulmonary edema happens, it's secondary to heart condition or due to a heart disease. Whereas in non-cardiogenic pulmonary edema, it is not related to any heart condition or a heart disease. Now let's look into detail what is cardiogenic and non-cardiogenic pulmonary edema. Before going into acute cardiogenic pulmonary edema, let's review the anatomy of heart and pulmonary circulation. So the heart has four chambers: right atrium, right ventricle, left atrium, and left ventricle. Blood from the systemic circulation, deoxygenated blood comes into right atrium, into right ventricle, and from right ventricle through the pulmonary artery, it is pumped into the lungs, and in the alveoli, gas exchange takes place. The deoxygenated blood gets oxygenated, and the oxygenated blood through the pulmonary vein comes back into the left atrium. And from the left atrium, through mitral valve, it flows into the left ventricle, from where the heart pumps blood into the systemic circulation. So what happens in a heart condition or a heart disease? Any of the heart condition or heart disease where heart cannot pump blood efficiently, the pressure in the heart goes up. As the pressure goes up, there is a backup pressure into the pulmonary circulation. More pressure in the heart, backup pressure into the pulmonary circulation. And when there is more pressure in the pulmonary circulation, there is increased hydrostatic pressure. What is hydrostatic pressure? That is the pressure exerted by the fluids. So more pressure that cause fluid leaking into lung alveoli, leading to pulmonary edema. What are the heart conditions that leads to pulmonary edema? Heart failure, where heart cannot pump blood efficiently. Coronary artery disease. That is, the arteries that supply blood to the oxygen is narrowed. That makes the left ventricle weak to pump. As a result, the pressure goes up and there is a backup pressure to the pulmonary circulation and fluid leaks into the lung alveoli. Cardiomyopathy, damage to the heart muscles where heart cannot pump blood efficiently. Heart valve stenosis, or it can be regurgitation. When there is a heart valve issue, the flow of the blood is impaired, more pressure in the heart, and there is a backup pressure. So any of the heart condition that causes heart difficult or hard to pump and increased pressure in the heart leads to backup pressure to the pulmonary circulation, increased hydrostatic pressure. As a result, fluid leaks into the lung alveoli. So any of the heart conditions that leads to acute cardiogenic pulmonary edema. Now let's see what are the non-cardiogenic causes of pulmonary edema. That means pulmonary edema not because of heart condition or heart disease. One of the primary cause is ARDS, that is acute respiratory distress syndrome. It's a condition where fluid fills up in the lung alveoli. This is secondary to pneumonia or septic. Whenever there is an infection, there is a systemic inflammatory response can happen. And this response, systemic inflammatory response, damage the capillary membrane. Remember, the alveoli is surrounded by a capillary network, and a small space between the alveoli and this capillary membrane is called interstitium. So, in response to the systemic inflammatory response, that damages the alveolar capillary membrane and fluid leaks into the interstitium and into the lung alveoli. That causes ARDS and pulmonary edema. Certain viral infection, example hantavirus, dengue, can lead to pulmonary edema. Adverse drug reaction or drug overdose. Drug overdose with cocaine, heroin can cause pulmonary edema, or salicylate overtoxicity. Salicylate toxicity can lead to pulmonary edema. Pulmonary embolism, that is blood clot in the pulmonary circulation, and if that blood clot is large enough to clot the arteries, there is increased pressure in the pulmonary circulation and fluid can leak into the lung alveoli. Exposure to toxins. Certain toxins inhaled can damage the lung alveoli and the capillary membrane. Smoke inhalation. Smoke contains chemical that can damage again the alveoli and capillary membrane. Fluid leaks into the lung alveoli, causing pulmonary edema. Drowning, that is fluid aspirated into the lung alveoli. Another cause for non-cardiogenic pulmonary edema is TRALI, that is transfusion-related acute lung injury. What is TRALI? That is pulmonary edema that happens post-blood transfusion. How does pulmonary edema happen after blood transfusion? This is because the donor's blood has antibodies. This antibody sometimes can damage this capillary network, the capillary membrane that surrounds the alveoli. As a result, fluid leaks into the interstitium and to the lung alveoli, causing pulmonary edema. Another non-cardiogenic cause of pulmonary edema is neurogenic, that is damage to the central nervous system. Whenever there is a damage to the central nervous system, example seizures, or whenever there is a brain injury or meningitis, there is increased catecholamine secretion. Catecholamines are neurotransmitters and they can constrict the pulmonary circulation. So when there is a constrict pulmonary circulation, or whenever there is a constricted pulmonary circulation, there is increased pressure in the pulmonary circulation. As a result, fluid leaks into the lung alveoli, causing pulmonary edema. Another reason is acute kidney injury, that is fluid overloaded from a kidney damage can lead to pulmonary edema. Hepatic dysfunction. So liver produces plasma protein. This plasma protein in the blood vessel has oncotic pressure. The oncotic pressure by the plasma protein helps to keep fluid, helps to retain fluid in the blood vessels. So whenever there is a liver dysfunction, liver problems, the plasma protein production is decreased. As a result, there is decreased oncotic pressure. Whenever there is a low oncotic pressure, fluid can leak into the interstitial space. And in the lungs, it can lead to pulmonary edema. Another cause of non-cardiogenic pulmonary edema is high altitude pulmonary edema. That is, when a person travels or exercise at a higher altitude, that is usually above 8,000 feet, pulmonary edema can happen. This is because at higher altitude, the inhaled air has low oxygen concentration. So this low oxygen concentration in the inhaled air can make pulmonary vascular constriction, narrowing of the pulmonary circulation, and increased pressure due to narrowing or constricted pulmonary circulation can lead to fluid leaking into the lung alveoli, causing pulmonary edema. Now let's see what are the signs and symptoms a patient exhibit when pulmonary edema happens. So the lung alveoli is filled with fluid. As a result, patient can exhibit shortness of breath, and it gets worse with activity or when lying down. Pink frothy sputum. That's a classic sign of pulmonary edema, and it can be blood tinged. It's because the fluid as well as small RBCs may leak into the lung alveoli, causing pink frothy sputum. When you auscultate, you will hear crackles on auscultation, wheezing or gasping for breath. Signs and symptoms of hypoxia include anxiety, cyanosis, bluish lips, cold clammy skin, rapid and irregular heartbeat. How will you diagnose, or what are the diagnostic tests done for pulmonary edema? Chest X-ray. Chest X-ray can confirm the diagnosis of pulmonary edema. You look for pulmonary vascular congestion. CT scan of the chest. ABG is done to assess the hypoxia. BNP is done if there is an elevated BNP that indicates an underlying heart condition. EKG is done to identify an abnormal heart rhythm, and echo to identify any problem with the heart muscle or with the heart valve. So what is the treatment for pulmonary edema? Remember, LMNOP. Stands for Lasix, M morphine, N nitroglycerin or oxygen, P for position and positive pressure ventilation. Lasix is a diuretic, so it helps to remove excess fluid. Morphine helps with anxiety, to reduce anxiety, shortness of breath. Also, it has vasodilatory effect. Nitroglycerin, it helps or relieves chest pain or chest pressure caused by narrowing of the arteries. Or oxygen is administered if the patient is hypoxic. P is position the patient upright. And positive pressure ventilation, that is BiPAP or mechanical ventilation if indicated. Now, if the patient has a severe heart failure, inotropes are administered to improve heart functions. What is the treatment for high altitude pulmonary edema? The treatment of high altitude pulmonary edema include help the client or patient to descend to the lower elevation, stay warm, and the medication used are usually Diamox or Nifedipine, which is a calcium channel blocker, helps to relax the pulmonary circulation and decrease the pulmonary edema. Now let's see what is flash pulmonary edema. Flash pulmonary edema is a medical emergency. What is it? It is a rapid onset of pulmonary edema and it happens secondary to MI or heart failure. It is a life-threatening condition and patient need immediate medical treatment. So today we learned about pulmonary edema and thank you for watching my video.